It's a story of a very young organ donor giving their heart, but it started a chain reaction that actually saved two baby girls. The surgery also made history.
This domino transplant was the first time in the world it's been performed on infants. A domino transplant happens when someone is a donor for a transplant and receives another organ. Mia Scatz was just 10 days old when she started breathing rapidly. Doctors realized she needed a heart transplant. Her family learned last September they had a donor, and they got a chance to help another sick baby. Mia had a still working part of her heart that could save a child named Brooklyn Civil. When doctors asked if they'd help, of course, the Scatz family immediately agreed.
One of the nurses said that Brooklyn will always have a piece of Mia's heart. It makes it feel like we waited so long for a reason.
You think about what the Scats did for us. They got such incredible news and they were able to think of somebody else in that moment.
So let's try to explain this now with our health expert, Dr. Paul Coley. So the domino transplant sadly begins with a young baby that is dying and will have a healthy heart but will not live.
That's right, but it does set off a domino effect where the donor and the recipient is the same patient. So we think about it, this really originated in the 1980s when we were doing combined heart-lung transplants, and we were taking out the heart and the lungs, but there were pieces of the heart that were working well, like the heart valves. So one of the surgeons scratched his head and said, why don't we put this in somebody else instead of just wasting the organ? And since then, we've done it in kids with livers, but this is the first time it's been done in babies. And I have to say, as a cardiologist, I think this is an incredible medical breakthrough.
We kidded with you last week about the heart dangling, but the human heart is a fist size of a fully grown person. A baby's heart is how big?
The size of their fist.
Oh,
so
so
extremely
like a golf
tiny.
ball or something.
That's
Yeah.
right. So, and an infant's heart is really small. And the problem here happens is you start to put valves that are donated from cadavers or from pigs or cows or mechanical valves. Those are designed for adults. So if you have a problem with the heart valve, which is the doorway that the blood uses to leave the heart, and you put an adult-sized valve into a baby, it can wear out quickly and it really doesn't last.
Yeah, and what you think about it and how delicate this surgery must be when you think of the size of a baby's heart. So in one case, the mom said she noticed her child breathing rapidly at like 10 days old.
Yep.
But it took a while to diagnose it, she said.
Yep. So
what is that?
So Mia had a cardiomyopathy, means her pump was broken, but her doorways were working perfect. Brooklyn, on the other hand, had a congenital problem where instead of being born with two exit doors for the heart, she only had one big exit door. So, and that exit door was leaking. It wasn't working well to hold the blood, from going out of the heart. So they took Mia's exit doors and put it in Brooklyn and gave Mia the new pump from the baby that was deceased.
So Mia was a recipient and a donor, and you think of people who are fully cognizant of their lives and the bravery it takes to be a donor or to go through a transplant as a recipient. But you think of these brave babies who aren't necessarily aware of how brave they're being.
It's true, and really what's incredible, and for me as a physician, is the heart and the valves are going to now grow with these babies. When you put artificial valves in, they don't grow, so you're signing the baby up for repeated operations through their entire life. But now, you really are hoping that these hearts and these transplanted valves will last these kids at least 20, 30 years, if not for the rest of their lives.
So it would be better if now that they've had this breakthrough with a baby, if they ever have these circumstances, that would be a better situation?
I think they've opened the door for us to now do this on a more regular basis where we're better about matching, we're better about using our organs in a smart manner so that we're not actually wasting pieces of organs that are working just fine. And just imagine how much it could impact the donor supply, which we know is such a bottleneck.
That's a lot about medicine and science, but it's also about the digital age and communication and the concept of trying to match. Because you think of, with these windows that very young, children, babies have, you've got a week, 2 weeks and things like that to get it done.
Exactly right, and it has to match in their immune system and everything. So really incredible. What a great day.
Yeah, it is. That's great. And just seeing
Great
those
story.
healthy babies, that's wonderful.
Thanks. Good to see you again, Dr. Paul Coley.